Gonna love the news and views on this show. We got Purdue University saying green tea helps everybody, and then USC, a study 11 years later that says, wait a minute, it blocks the effect of a cancer drug. Okay, let's go to news and views here within the show. Call your friends and tell them about this show, because in the opening, I'm going to respond to probably 60 questions we had a few weeks ago in Oklahoma City. What is this fungus? How can it get in my body? And why does my doctor know about that? We're going to talk about that as we open today's show because of so many new viewers. Dr. Fred Pescatore, we flew off to New York and sat down with a good doctor, and he talks about the microgut flora, the yeast and the bacteria that should be in the intestines, but often isn't. Anita from Oklahoma City had a wonderful question. We captured her on tape, and I'm going to answer her questions here today. And then my news and views you're going to love. The NSC Minute, thank God for Frank Jordan. All that and infinitely more good things on Know the Cause. Okay, so what are some of the answers to all of those questions that people come up to me and ask? This was interesting. Oklahoma City a couple of weeks ago, huge number of people there. We didn't expect that many, but God bless them, they were all there. They came up and said, Doug, what is this fungus? I came here to buy, dairy products today, and all of a sudden you were up there speaking. What are you talking about, this fungus? I just watched you on TV. This is all brand new. We tend to know in clinical science that bacteria can infect our body, or viri, right? We get herpes and so forth when a virus enters our body. We don't tend to know what happens when fungus invades our body. One of my favorite books goes back, 12 or 13 years ago. It's Principles and Practice of Clinical Mycology. MYCO means fungus. And in this book, it makes a statement. What are the parameters that set up a fungal infection? In other words, why do people get fungal infections? Remember, these authors are from Duke University, National Cancer Institute, Stanford University. These are the big boys. In this book, they say, these factors are influenced by a wide range of physiological and metabolic abnormalities, including diet, vitamin deficiency, pregnancy, endocrine dysfunction, extremes of age, and treatment with antibiotics and other drugs. Bingo. In other words, we set ourselves up as we age for a little bit of a hypoimmune problem. Hormones rage during pregnancy and endocrine malfunctions and so forth. This book goes on to say, where does this stuff grow? If it grows in the human body, here's chapter 17, fungal infections of the respiratory tract. Chapter 16, fungal diseases of the eye. Trust me. You talk about corneal transplants, you got to start studying fungus, all of you doctors that do these. Chapter 15, fungal infections of the kidney and those associated with kidney failure. Number 14, fungal diseases of genitourinary medicine, including a subchapter on fungal prostatitis. The same yeast that can grow inside women is the one cultured from the prostate of the male. You know where I'm going with this. Fungal infections of the gastrointestinal tract, I think, very, very common. Fungemia, once it gets in the blood. Fungal infections of the ear, nose, and throat. Fungal disease of dermatology. Fungus causing mass lesions of the central nervous system. Do you think this can affect your speech and your brain and your ability, your gait, your ability to walk and think and talk? Fungal meningitis, coatings of the brain and spinal column. Fungal disease of the heart. Fungal disease of the bone and joint. As a matter of fact, I believe it was this book, goes on to say the only place this stuff can't grow is in the teeth. I disagree with that, but I think it can ravage the human body under certain conditions. Now, I have a book over here that I want to pull some notes from because, and I forgot I had this book, but I have some old notes. These fungi make poisons. They're called mycotoxins. Not all fungi make poisons, but Candida albicans, the one many books have been published on, makes a poison called a gliotoxin. In this book, Antibiotic Optimization, which is a book I bought for $3, and it is loaded with good stuff. Nothing to do about this book, but antibiotics can, in fact, cause fungal infections. I made notes long ago about two of the most common mycotoxins. Now, when we're saying mycotoxin, MYCO means what? Good for you. Fungus. Toxin is a poison. Let me just read over some of my notes. These are amazing. Fusarium. It's a fungus that makes certain mycotoxins. The mycotoxins occur predominantly in grains, such as wheat, barley, oat, rye, and corn. Some species produce mycotoxins, one of them called vomitoxin. What do you think that makes you do when you get too much of it in you? This mycotoxin occurs predominantly in grains, I already said that. The group of structurally related mycotoxins has strong impact on health of animals and human beings, and they suppress your immune system. And they're in cereal crops. In humans, some species may cause a wide range of opportunistic infections in human beings. In humans with normal immune systems, fusarial infections can occur in the nails. You've seen toenail fungus. And in the cornea of the eye. How I wish every doctor knew this. In humans whose immune system are real weakened, we find low white blood counts called neutropenia. Fusarium venetatum is produced industrially for use in the human food by Marlow Foods Limited. Human foods, we're eating fusarium. Corn, Q-U-O-R-N, is fusarium. Another one called zearalenone. This is an amazing one. Zearalenone is a primary mycotoxin that causes infertility and spontaneous abortions, breeding problems in animals. This one I think is so fascinating because zearalenone turned male swines, began feminizing male swines. Amazing. This is a very potent, it's called an estrogenic metabolite. So women with estrogen-dominant breast tumors and so forth, think about corn in your diet. Finally, this one, aspergillus. It was named by a Catholic priest in 1729 because it looked like that aspergillum that they use, that they put the holy water. Those of you who are Catholic have seen the priests do that. And it looks just like that. It grows off a tail. More than 60 aspergillus species are medically relevant pathogens. For humans, there is a wide range of diseases such as infection to the external ear, skin lesions, ulcers, mycotomas, etc. Aspergillus niger can be found growing on damp walls. It's a major component of mildew. Perhaps one of the best known applications of Aspergillus niger is that it is the source of 99% of citric acid. What is soda pop? Citric acid, it's made with a fungus, with a mycotoxin from the Aspergillus mold. Folks, we're going to continue this because I think it's very, very important. Now that we know how we're getting in touch with this, antibiotics, corn, wheat, etc., cereal, what do we do to get it out of our systems? It needs starving and it needs killing, so don't go away. I'll be back.
So what Doug is doing is extremely important. As the years go by, we'll realize that he was a pioneer approaching something that so many people need to be looking at, that he's willing to stand up there and take the arrows and help us and help our future generations.
Your cholesterol is too high. What can you do naturally? High cholesterol contributes to the deaths of 250,000 Americans each year, while coronary disease is the #1 death cause in the U.S. Why? LDL cholesterol collects on your artery walls where it can produce plaque. Plaque blocks arteries that can cause strokes and heart attacks. Beta-glucan nutritionally promotes increased HDL, good cholesterol, that promotes immune cell removal of plaque. Combine NSC 100 Immunition MG Glucan with MSC Immunition CoQ10 to fight free radicals and help your body help you to reduce excess cholesterol. Stop sugar and refined white products to help even more, and exercise moderately with a good brisk walk. If your cholesterol is too high, act today to remove plaque, and remember, when you can't, Immunition Glue can.
News and Views brought to you by NSC Immunition. Ammunition to win your body war.
Okay, now in this hand I have Purdue University, in this hand I have USC Medical School out on the West Coast, one against the other. A husband and wife team by the name of Moore in 1998, 11 years ago, found that green tea was really beneficial to health. You got to drink about 4 cups of it a day, they said. Green tea, long associated with good health, has new scientific evidence to back its claim. Purdue University researchers, tells their names, found that a component of it, ECGC, or ECCG, a compound in green tea, you don't have to memorize that. Compound in green tea inhibits an enzyme required for cancer cells to grow, and it can kill cultured cancer cells with no ill effect on healthy cells. They go on to say a study suggests that drinking more than 4 cups of green tea a day could provide enough of this active compound to slow and prevent the growth of cancer cells. Huge! That's really, really exciting. I mean, green tea is something I drink quite a bit of, and I'm happy to read that. I brought that to you probably when I first began my television career, 1997, 1998. Now this. Zoom forward with me 11 years. Green tea, says the headline from the same Science Daily, green tea blocks benefit of cancer drug. I couldn't believe I was reading this. Contrary to popular assumptions about the healthy benefits of green tea, researchers at USC have found that a widely used supplement, green tea supplement, renders a cancer drug used to treat multiple myeloma and mantle cell lymphoma completely ineffective in treating cancer. And it's the same thing. It's this EGCG benefit of green tea. The same thing is published in the journal Blood. I would love to read that journal. It says a study which found that a component of green tea extract called EGCG destroys any anti-cancer activity of the drug Velcade. And I'm thinking, activity? Shouldn't that say any benefit of the cancer drug? I wonder how beneficial this cancer drug really is to those with lymphoma and other types of cancer. I got a problem with this. Moores must have done something wrong out of Purdue University. They've upset someone. It's just so ironic to me that 11 years ago we said at a respected Ivy League medical school, we said drink green tea, 4 or 5 or 10 cups a day, and it can prevent cancer. And then along comes this, well, the drug doesn't work when you drink green tea. Do you suppose, my friends, if you'd have drunk it 11 years ago like they said to do at Purdue, we wouldn't need USC's research at all? And that makes me smile.
Did you know that cholesterol-lowering drugs are among the most prescribed medications on the market, even though patients report a host of side effects? Have you seen the ads on TV for cholesterol medicine? This isn't a criticism, but I have some serious concerns about these drugs. It's interesting to note that some of the drugs prescribed to lower cholesterol can actually deplete the body of CoQ10, a nutrient that's absolutely essential for heart health. Isn't heart health the reason to take those drugs in the first place? You should know that my customers have had a lot of success following Doug's Phase 1 diet and taking a totally safe supplement that includes niacin, gamma-oryzanol, artichoke, and of course red yeast rice. Want to know if this supplement is right for you? Just call my office or visit bioactivenutrients.com. I'm Guy Evans, and now you know.
Call today at 1-800-879-6504. Have you been on every diet in the country and still not losing weight? Have you seen a nutritionist and continue gaining weight? The Fungal Link to Weight Loss is a science-based weight loss program for American families. Doug's book, The Fungal Link to Weight Loss, explains why you're overweight, and it may not be that you're overeating. This book is loaded with amazing information that will affect your health in a good way so that you will know the cause. Go to knowthecause.com and order The Fungal Link to Weight Loss right now in time for Christmas. It's the present that will change a life. Maybe yours.
I'm all for Purdue on that, guys. I really am. I believe that, cancer-fighting drugs are poisons themselves, right? So here's green tea, the innocent little guy, even killing the poisons that can cause cancer and causing the poisons that we use to treat cancer with. So USC, you need to tell all the people who come out there to Southern California, look, start drinking green tea, lots of it, okay? Now, let's move on. In the opening today, I told you a little bit about this zearalenone. Zearalenone is a primary toxin causing infertility, abortion, bleeding problems, especially in swine, the animals that have been studied. I think the same holds true in the human market. People are lining up to see fertility specialists, $20,000, $30,000, $40,000. You need to think about how much corn tortillas, corn chips, popcorn, etc. in your diet, because corn is universally contaminated with these fungal poisons. It also says here that it is heat stable. You can burn the fungus off, you can't burn the mycotoxin off. How do you get rid of it? Antifungal drugs, if you're very, very ill, now that I've read the intro to this book to you, if you're very, very ill and you're saying, that's right, I do have arthritis, Doug, this might be fungus in my joint. I do have depression, it might be fungus in the brain, I do have skin problems, etc. Then what you got to do is starve it. We have a phase 1 diet that says don't eat the foods that feed this parasite, fungus, inside your body. This diet makes much more sense than any diet out there on the market, including the micro meals of pizza that big. You have to start thinking of starving the pathogen inside your body. So we have the phase 1 diet, which is lots of vegetables, green apples, grapefruit and berries, meats, chicken, eggs, nuts, etc. It's on our website. If you go to frequently asked questions at knowthecause.com, you can get that diet, or it's in all of our books. Number 2, kill it. Okay, do we use big bullets, big guns that doctors have to prescribe? I think sometimes that's necessary. If you have a very serious disease, an autoimmune disease, and the doctor doesn't know what to treat you with, say, stop this suppressing medicine, put me on a drug called diflucan and nystatin. These are antifungal drugs. I think they're totally harmless drugs. While you're following the phase 1 diet, go back in for a blood test a few months later. The doctor doesn't know how to measure you for fungus, although there are labs that do that. He will just say, let's try an antifungal medicine if that's where you want to go. How important is the terrain of the intestine with the foods you eat? I sat down with Dr. Fred Pescatore in New York, and boy, he really filled my head with good information. This segment highlights the effect of what is called the microflora in our intestine. Now, what does that exactly mean? Dr. Pescatore and I discuss how probiotics can help in weight loss. We find out what do the good bugs in our intestines do for us in the first place. Watch this. Thank you for joining us, Dr. Pescatore. Really appreciate you allowing me in your office finally, after you've been coming to Dallas so often. New York City. What a grand office. What a grand doctor. Effects of gut microflora on weight gain. An article came out of a Japanese magazine, and there are, 10,000 Japanese doctors that wrote this.
It's a Japanese journal.
It's a journal.
Not a Japanese magazine.
It's a medical
difference.
journal.
Right.
And these doctors are saying, uh-oh, here's another thing. As I go through all my science, probiotics for kids to prevent respiratory infections, probiotics to prevent kidney disease, probiotics for everything. Now they're saying probiotics can assist people in losing weight. What are your thoughts on that?
Well, my thoughts are, how can it not? I mean, when you think about it, when you think about how our gut absolutely affects everything we do. So if you're not getting the nutrients you need, I mean, we can take it simply from that. Okay. If your gut is dysbiotic, meaning it's not absorbing nutrients, so you're not absorbing the nutrients that you're taking in, right? So what does that mean? That makes you more hungry.
So you're going to eat.
So you're going to eat more. So that's just one simple way of looking at it, right? Second way of looking at it is, we don't even know what most of these bugs in our bodies do. But we are learning is that a lot of them are chemical messengers. So they're telling our brain, because our gut is also considered our second brain, let's not forget about that. I mean, produces serotonin and tryptophan and all sorts of things that in our gut that are good for brain health. Well, it also is a chemical messenger to tell our bodies whether we've eaten too much, that we're full, that we've gotten pleasure from that food that we've eaten. So there's lots of things in there, in our gut, to help us lose weight if we only listen to it. And we don't necessarily listen to our gut, nor do we pay attention to it. All we say is, oh, I've got fat around my gut, but that's not really what we're talking about. Right. And inflammation is a really big part of all of this, because that's why people are fat around the middle, is because they're having inflammation, they're having cortisol being released, and our body deposits this adipose tissue right around our gut.
Did you happen to see Time magazine a couple of years ago with I think it was the elbow joint, and it was inflamed and it was red, and it said, inflammation, could it be the cause of cancer and Alzheimer's and diabetes and so forth? And I laughed just like you're laughing now, but doctors really believe, or scientists really believe, that the cause is inflammation. Well, what caused the inflammation? And what they're saying here is probiotics are anti-inflammatories.
Right.
Why in the world wouldn't anybody be taking them all the time?
Well, when they could be taking non-steroidal anti-inflammatories from a drug company.
Or antibiotics or cold beer.
Yeah.
I can't understand why they'd take probiotics.
Absolutely.
People need to stay on probiotics. There are two schools of thought. take them until you don't need them anymore. And when we say them, we're talking about Dr. Ohhira's probiotics. I think
Right.
you would agree.
Oh, absolutely.
You and
It's
I
the one
both
I
agree.
recommend, yeah.
Dr. Ohhira's probiotics. But two schools of thought. Okay, take them till the tummy problem clears up, right? The diarrhea goes away, or the bowels start working again, or the hiccups go away, or the GERD goes away. The other school of thought goes all the way back to Metchnikoff 100 years ago, who said old milk yogurt bacteria actually retards the aging process. I'm
right.
kind of into that right now.
I think most of us are.
So would you recommend, what do you recommend to your patients? That they stay on them?
That they stay on it forever. I mean, I think when you look at the studies, when you look at the longevity studies, when you look at things like that, I mean, there's reasons why people who, remember that old commercial, people who ate yogurt lived longer? Well, I mean, there's a reason for that. And Dr. Ohhira's Probiotics 12 Plus is a live culture medium. So you're actually getting live cultures when you take that pill. And I think, so it's part of anti-aging, it's part of losing weight, it's part of being anti-inflammatory. I mean, inflammation is rampant. So yes, it was on the cover of Time magazine several years ago, but then what has science done with it? Nothing, because we have all the anti-inflammatory medications we need. It's time to actually go out, what's causing that inflammation, and why don't we put a stop to the inflammation? Well, if we put a stop to the inflammation, we wouldn't need to be buying all these drugs, and that's the real problem. So put a stop to the inflammation, take Dr. Ohhira's Probiotics 12 Plus, and get your gut to work right.
20 seconds left. Does it bother you that your peers don't know this?
Does it bother me? No. Then I wouldn't have as much of business as I have. But yes, it actually does. That's why I go to medical schools and teach about this stuff.
Dr. Fred Pescatore, our good friend, and yet another physician who recommends Dr. Ohhira's 12 Plus. Thank you so much for your time.
Thank you.
I'll be right back.
My heartburn is bad.
Guys like to joke about gas and bad breath, but it's really embarrassing.
Heartburn and gas? Actually, most digestive problems go away when the intestinal bacteria are balanced. I have my patients support their good bacteria with probiotics. Good bacteria do many jobs, such as keeping bad bacteria and yeasts from taking over.
Dr. Ohhira's probiotics are alive, not freeze-dried. Normally you swallow them, but my doctor says I can chew one or two if I need fast relief for my heartburn.
Doesn't need refrigeration? Great. Let me take it with me when I travel.
I recommend specifically Dr. Ohhira's Probiotics 12 Plus, and take it myself because it's the only complete probiotic system. Not only do the capsules contain probiotics, but they also contain the food the bacteria need, plus the protective substances they produce.
For more information, visit probiotics12.com or call 800-768-1008.
Well, I know I have the fungus problem going
My
on.
question is that I have a friend in Tulsa with all the bad recycled air in the air pipes.
Stabilize an immune system?
You've got fungal questions. I'll try to provide fungal answers.
And my question is that I have a friend in Tulsa. His wife died recently of pancreatic cancer, so I'm thinking there might be fungus going on between both of these people because he's got some toenail fungus. So I want to put him on an antifungal program that's not drug related, and I want to know if that will be, I know it'll take more time. He's using tea tree oil on his toenails right now, and he's seen some improvement, but he doesn't have a whole lot showing up, just like maybe 1/4 of his big toenail, of one toenail. So I don't think he has it really bad. So I think maybe we can kick it out with the antifungus kit, but just wanted some recommendations on how to do that, maybe without some hardcore drugs, if that would be possible.
Oh, Anita. How many people have asked that question, and what did you think when you were watching that? Two things came to my mind. Number one, Anita, thank you for thinking of the intimacy factor. That's something that OBGYNs are just lost, in my opinion, on this. We need to talk to our spouses about a dermatophyte, a fungus that can live on the skin and wants nothing more, instead of 65 degrees out here, to be in 98.6 degrees. You know where I'm going with this. Very often when you see a sick wife, you see a sick husband. And so thank you for bringing that to our attention. Remember this morning earlier, or when I was talking with you about this, there was one chapter in here that I thought was so relevant. Fungal disease in genitourinary medicine and those causing fungal prostatitis. We are passing this yeast back and forth. Second thing, thank you for being concerned about him. A third of a toenail, we call this onychomycosis. There are these skin fungi that can get the hair and the nails impregnated, and then we're just miserable. Tea tree oil, I really like that. Vicks Vapor Rub, the camphor oils are strong antifungals. So was it a fungal infection when Mom used to rub it on our chest before we'd go to bed at night, Vicks Vapor Rub, or was it a viral infection? Vicks worked. Must have been a fungus. I think we're confusing virus, bacteria, morphology. I think we're confusing that very often. So just tell him it'll take longer. Sometimes it takes over a year. But before he goes to bed in the evening, just rub some Vicks Vapor Rub, tea tree oil. There's so many things. Colloidal silver is good for eradicating fungus, caprylic acid, beta-glucan. I really like what Frank teaches us on this show every day, to get your immune system up. And the only thing I've found that really helps with that is the beta-glucan. The one thing he might be able to eradicate this on his own, no matter what his age, is with the phase 1 diet. Probably for a month or two, I just follow that phase 1 diet. There are plenty of foods. Go to our website, Know the Cause. Click on Dining with Denny. There's got to be, a huge number of those on the website. Now, every once in a while we throw in questionnaires, and I really like them a lot, and I like this one that our producer John put together. In the book, Fungal Link to Diabetes, which many of you own, by the way, that book is a bestseller, and we're right on this diabetes. Which supplements are good for the heart? 1, CoQ10. 2, magnesium. 3, hawthorn berries. 4, L-carnitine. Or 5, all of the above. When we get back, before we close this show, I will give you the answer, but I think you guys might already know this. We'll be right back.
So I started the diet on August 1st of 2008, and in 6 months I've lost 45 pounds, and my tumor markers have been decreasing steadily.
You know Seagate's natural remedies help for colds, flu, and fungus. Now Seagate's website helps save you money. Go to SeagateProducts.com. The specials change every week. Sometimes it's free shipping or discounts on one or more of Seagate's 27 natural remedies and volume discounts. Also new, visit Seagate's blog for the latest health news. You can post your comments and ask us questions. Save at SeagateProducts.com or call us at 1-888-505-GATE.
You and I are not scientists, but what does logic tell you? If you swallow an antifungal drug and cancer doesn't metastasize through your body, what's the cause of cancer? Isn't this fascinating? We learned a lot today. Let's answer this first. In the book, The Fungal Link to Diabetes, which I authored, which supplements are good for the heart? CoQ10, magnesium, hawthorn berry, L-carnitine, or all of the above. L-carnitine is an amino acid. All amino acids are antifungal, as are the other things, so the answer is 5, all of the above. Thank you so much for being with us today. What did we learn? Are cataracts really fungal diseases of the eye? Time will tell, folks, but I think that's true. Why don't doctors know about fungus? Antibiotics, there's thousands of them on the market, so that's what doctors learn in medical school. There aren't so many antifungals. God bless you. I'll see you again tomorrow. Bye-bye.